8 we have our Hindi session. 8 to 9 we have our international session in English, and 9 to 10 local language session in Malayalam. And today, the 132nd day, we have Dr. Prakash Rao, the senior scientist who retired from CCRH, who is having MD in homeopathy and with PhD and holding a postgraduate diploma in physical medicine and rehabilitation. Sir has undertook projects with the UNICEF and AIDS Control Society, and the winner of many awards for outstanding work for homeopathy. And Sir has having more than 30 years of experience of Central Council of Homeopathy. Dr. Prakash Rao has presented so many papers in this forum, and all were connected with the research papers. And last time, Sir has presented what is cure and curative, and it, already there was 3 sessions. 2 sessions are over, and today it will be the 3rd session. So let us begin the session. I think Sir has not joined. Sahani sir, please.
Sir had entered during the Hindi session, but he left at that time.
Okay, sir. Okay, sir. Maybe, sir, I shall call him.
Yeah.
Sir, you may talk about the cure for some time, so that in between I shall call back. Maybe the network problem,
the
sir.
Topic that Dr. Prakash Rao ji has taken is a wonderful topic, and I feel that he has spoken a lot, and his experience is very vast. Luckily, I had a meeting with him at New Delhi on this 10th of April, and he was able to. I was very glad that he also accepted to participate in our Hindi session, and he has given a time in the month of May to speak on the same topic that we are presenting today in the Hindi session also. So we shall be very grateful that Dr. Prakash Rao. Now Dr. Prakash Rao has joined now, and you can make him the co-host so that he can start the sessions. Dr. Prakash Rao has joined now, sir.
Network problem with me also, sir. Okay, sir. I am making Prakash Rao, doctor, as the co-host. Yes, welcome, Prakash Rao, sir. Already we have introduced you to the session. We can begin the 3rd part of our session. Yes. What is cure and what is curative? Yes, sir, you are joining it from 2 set or 1.
Sir, can you see my slide, sir?
Yes.
Sir, you have to allow me to share, sir.
Yes, everything fine. Everything fine.
Okay, sir.
We can order.
Dr. Sahani, sir, all senior doctors, Dr. Dhanesh, Dr. Manoj, everybody, good evening, and I am starting my session. What is cure and what is curative? Just remind of previous this one, so that you will be fresh to understand what is cure and what is curative. First, what is cure? Chronic obstruction. See, these are the diseases. You kindly see what is cure and what is curative. Cure is disappearance of signs and symptoms and making the life force to keep the life force, to keep the functions of the sensations and functions in harmony. What happens when cure? Disappearance of total signs and symptoms, making the life force to keep its functions, and all the sensations of the body will become normal, as if into the former state of the body. The highest ideal of cure is what? First aphorism, 5th, 6th, 7th aphorism will tell is the highest ideal of cure is rapid, gentle, permanent restoration of health, annihilation of disease in its most harmonious way, as to bring the old state of the body or old state of the health. That is the definition of the cure. Cure is permanently removal of the sufferings in a healthy human being and bringing the former state of health. Modern definition is removal of signs and symptoms of more than 3 years. See, in modern medicine, they don't consider cure, suppression, they know only how to treat. So for them, removal and disappearance of signs and symptoms for more than 3 years is known as cure. Whereas in homeopathy, permanently disappearance of signs and symptoms till the person lives, till the death of the patient, removal of total permanent disappearance of signs and symptoms. Then what is again is the word cure comes from Latin word cura, which means care, concern, and attention. See, when we talk about cure, when we talk about management of the patient, we will say that holistic approach and body, mind, and spirit. But the word cure contains all three: care, concern, and attention. This is not understood by various people. So when they talk about cure, they also talk about maintenance of in a holistic manner. The cure word itself is a holistic word. So a cure is a treatment that eliminates the disease or illness, such as bacterial infection, treated with antibiotics. It can also refer to the state of being healed or restored to a good health. A cure can be a substance of procedures such as medication, surgical operation, lifestyle change, or philosophical mindset. What happens? We think cure means giving the only medicines. So it is not giving the only medicines. It also giving the making the patient to undergo surgery and making lifestyle changes of the patient and philosophical setting of the mind. That means we are forced to tell the patient that we are only doctors. We can keep away your disease condition in between birth and death. But we are not going to give you removal of the death is not cure. Removal of the death is not physician's function. This philosophical mindset we have to create in human being, in patients, that comes under cure. So cure is totally a spiritual word. As where is the spiritual word comes, that is from totality of the symptom. The totality is nothing but spirit, mind, and body together. So when we apply, the patient has been cured means he is mentally prepared. His symptoms have totally disappeared. He entered into the formal state of his body. So merely cure doesn't mean removal of the disappearance of signs and symptoms. So a cure is different from recovery. See, I will tell you what is the recovery later. These are all the small things which you know, which means getting better and not abusing substances. Most of the disease conditions are not curable. See, we are telling cure, but there are the disease conditions. Usually we will get such cases and we palliate in such cases where the even minimum palliation is also not possible with allopathic medicine. That is the greatness of homeopathy. What happens? Usually we get chronic cases. Chronic cases usually incurable. So those incurable cases which are being palliated by homeopathic doctors, even the palliation, suppression, management is also not possible with allopathic doctors. These all terms are having different meanings. A cure, when a treatment makes a healthy problem to go away and it is not expected to come back. Some health problems have a cure. For example, to treat athlete's foot, healthcare providers use special creams, powders, sprays that kill the fungus that causes the infection. See, these all are simple cures. What is cure and what is curative? A chronic, see, in our 70th practical part of the Organon, Hahnemann in those days, in his 6th edition and 5th edition of Organon, without deleting this one, he elaborately classified the disease conditions. A chronic disease with fully developed symptoms. In that, again, there are miasmatic disorders, non-miasmatic disorders. The non-miasmatic disorders are from hygiene, from iatrogenic causes, the side effect of the drugs, and occupational hazards. If we remove that particular person or the patient from non-hygienic conditions, or if we stop the patient not taking that particular drug, or if we remove him from his occupation, he will be okay totally and he will be cured. But in miasmatic cases, there will be single disease, there will be compound disease, there will be double miasmatic disease, there will be triple miasmatic disease, psoriatic, syphilitic, psychotic. Psora, syphilis, psychosis, psora, psychosis, psora, syphilitic, psoriatic. So, for example, there is rheumatoid arthritis. Rheumatoid arthritis is multi-miasmatic disorder. This multi-miasmatic disorder will have psoriatic affection as well as psychotic affection. And there won't be any, again, there will be a discussion in homeopathy. Psora and miasm psychosis together without syphilis. No, it won't be like this. Any chronic disease, if we classify, it will enter, it will develop stage by stage. One psora develops, then syphilis develops, then psychosis comes. Then if that is a psychotic disorder, it doesn't mean there is no disorder of syphilis or psora. This usually in college studies, we will not be educated about what is cure, which are curable diseases, which are not curable, what is the disease condition, how much time it takes. Suppose, for example, to treat a typhoid, enteric fever, can we treat the enteric fever or can we treat the stroke? Can we treat the acute attacks of bronchial asthma? Can we treat the fevers? How to treat a fever? What are the fever medicines? See, these are the studies which are not covered in college education. College education, they will give therapeutics, but they never explain that for a physician, these particular medicines are present. Though the therapeutics and repertory, suppose a gelsemium, arsenic, rustax, some other drugs, acid mute, they are for fevers. You cannot expect a miracle action with these drugs in some of the most of the complication cases. So such a type of development of specific knowledge for the diseases that are curable is not taught in medical colleges. They will be taught therapeutics, there is no doubt, but the efficacy of the therapeutics is not shown practically to the students in the college. So they only will tell that if your selection of the drug is okay, the symptoms are cured. Whether selection of the drug is okay, if we select the patient on totality of the symptoms, but if there is no efficacy action of the drug on that particular part, it will not see, you cannot cure a fever case with sulfur, or zincum metallicum never cures headache. So the totality of symptoms, taking case record, miasmatic approach, these all will not work out until and unless the medicine that is having affinity over the body, then only the symptoms of that particular patients will come down. This will not be taught in colleges. That is the defect of our college education. Then what is diseases with few developed symptoms? What is the cure? To achieve cure, we have a disease that is having with few developed symptoms. One-sided disease only mental symptoms. B, local diseases, surgical and non-surgical. Again here, disease with few developed symptoms. See that if disease will have, see migraine will have only few symptoms. Migraine will not develop, see migraine of wrist joint, we can't tell. Migraine means there will be headache. That headache will be only in the head. It will be in the temporal region. There will be aura for migraine. Patient may vomit. Patient will have vomiting sensation. If patient goes under the sunlight, his headache may increase or his headache may decrease. Patient, sometimes the headache will be only one-sided. So one-sided disease only mental symptoms. See, one-sided diseases are mental symptoms. Not mental symptoms, mental disorders. Schizophrenia, depression, double complex diseases are mania, hypomania, and hysteria. These all will come under one-sided diseases that are mental symptoms. Usually the mental symptoms are composition of mental diseases. So mental diseases are also incurable. Local disorders are sometimes some of the disease, fracture of a bone, fracture of femur bone. We have medicines to relieve the pain. We have the medicines to relieve or we are having medicines to get bone ossification quickly, but we don't have surgical mechanism. So at that time, the orthopedic surgeon's need is necessary and local surgical disease has to be cured surgically. Or some of the infective tonsillitis, highly developed, totally developed peptic ulcer, fourth grade piles, fourth grade sinusitis, fourth grade otitis media, where the infection will lead to fever. In those cases, surgery is needed. As a homeopathic doctor, we have to know whether the disease is needed surgically removal of the disease or whether the disease is curable with the medicines, with homeopathic medicines. So despite of all these things, 5 diseases that are now fully treatable. Treatable doesn't mean curable. Management. These 5 diseases are tuberculosis. In tuberculosis, the signs and symptoms of the disease will totally disappear for about more than 30 years. But when age progresses, he will develop either secondary tuberculosis or age-related lung disorder or COPD, chronic oppressive pulmonary disorder, and that is or secondary tuberculosis. So anything will come. Sometimes the patient will survive up to the age of 92, but his death will be the cause of the tuberculosis, which was caused 40 years back, and that ultimately will leads to COPD or fibrosis of the lung tissue, and the old heel injury will become again suppurative, and the tuberculosis will come up, and there won't be any medicine at that time. That will be a resistance to tubercular resistance will come, and chronic pulmonary disease he will develop, and patient will die. A cure has existed for tuber decades ago. See, I will tell you either one scientific manipulation. See, science is such a thing, it will change day by day. It is not the science that changes, but it is the understanding of the science that changes. In 1965, from 1962, from 1970, there was tuberculosis sanatoriums. Everywhere you used to find tuberculosis special hospital and tuberculosis sanatoriums. The sanatoriums are constructed, suppose like what corona spreads, masks came, double mask theory. Corona patient have to be kept out. But by the time he infected many people, by the time he was diagnosed. In the same fashion, in tuberculosis also, in 1960s, what happened? Government have spent so much of money to construct tubercular sanatoriums, and a patient used to be isolated, and those sanatoriums used to be away from the dwelling places, from villages, and every district used to have a district tubercular sanatorium. But in 1970, the person who was admitted in sanatorium, when studies have been made, he used to suffer from chronic disease of tuberculosis for more than 3 months. He used to cough and put the sputum in the outer parts of his house. So everybody used to get infection, and they used to get resistance for tuberculosis, where the Mantoux test, if it is done, it will develop into positiveness, and if it is Mantoux test is not done, they used to grow early and healthy also. So the tuberculosis, after he infected for about 3 months, after the diagnosis of tuberculosis on X-ray after 3 months, that particular patient was brought to sanatorium and he was given streptomycin injections for 90 days. Then he recovered and he has gone home. By the time another person used to develop tuberculosis from him home, suppose if there are 10 persons present, 2 persons used to develop tuberculosis from every house. By the time the government has spent total money on construction of sanatoriums, nowadays those sanatoriums are being utilized for AIDS patients. You will see in every district hospital that tubercular sanatorium is used for AIDS patient or for office showroom. So this is the science wastage of money. See, allopathy doesn't mean, WHO doesn't mean they will give good suggestions. Here also, this also happened in COVID-19. By the time he was tested with a CT scan, his COVID used to be positive. And then he was admitted, then total house was washed. He already infected for 3 days, and after infecting the 3 days, other persons not getting COVID, and this person only getting COVID, and he was isolated. These all are scientific jingles where the scientist never understands, but out of fear, because when there is no way to cure the disease, the way that they know, they will implement on the general people. That happened in tuberculosis, that happened in HIV/AIDS, that happened in the coronavirus also. So malaria comes because malaria is not a serious disorder. Even cholera comes with waterborne infection. That is also not a serious disorder. The society has accepted, the scientists have accepted. The tuberculosis that used to kill in old cinemas, the heroes used to die with tuberculosis and they used to be sent to tubercular sanatorium. So these are the outdated scientific theories which will make and which will spoil the money, because in those days also the construction of sanatoriums was in the hands of the government contractors. They used to tempt the government and health ministers. So they constructed the tubercular sanatoriums in every district of India. So this is the one scientific story. Then cure, these top deadliest cures are, see, cure is not possible, but with surgical disease we will remove. Ischemic, see, ischemia, heart disease, where the stent will be passed, but the patient ultimately develops heart disease, heart failure. Despite of the stent, he will be okay for 20 to 25 years. The stunt life will continue for 30 years. There are different stunts. Indian stunts will continue for about 10 years. The foreign stunts will have around 30 years of life, but patient dies only with heart attack, whether there is stunt present or stunt is not present. And if patient never dies with ischemic heart disease, he will develop stroke. In stroke, now they cannot pass stunt because the minute arteries are blocked. Once the heart is being passed, the arteries CAD, coronary angioplasty has taken place. The stroke symptoms where they cannot put a stent in the brain arteries. So the second attack will be highly severe, where the patient will go into coma, where his medulla oblongata will be cut off with blood supply and he never recovers from the stroke. And lower respiratory disorder. These are the secondaries to tuberculosis. Primary, that is fibrosis of the lungs will come. Trachea, bronchus, lung cancer and paralysis of lungs. These paralysis of lungs, if you read Antimonium crudum, in Antimonium crudum he will put a word, paralysis of lungs. This paralysis of lungs, how it was curable, who developed the symptom, how that word came into Materia America is really surprising and looks like unscientific, because the paralytic of lungs patient will be in coma and prover never develops paralysis. That means the provers which Antimonium crudum has been proved is on 55 provers. So those 55 provers, nobody has developed lung paralysis. So how that was noted, and it is very difficult for us also to see a lung paralytic patient. He will be in intensive coronary care unit and that need a special attention. And almost after death only the paralysis of lungs came, means the death came. The paralysis of lungs patient never survives. But our Materia Medica is not scrutinized. Then the diabetes mellitus. Any diabetic patient will die with the complication of the diabetes in his lifetime. There won't be any cure for this one. Then chronic obstructive pulmonary disease, Alzheimer's disease, dehydration, tuberculosis, cirrhosis. Apart from these, snake bites. If the snake bite patient never reaches in the golden hour to the hospital, though the snake venom is present, if the venom is given, he will not survive. The homeopathic medicines of snake bite, there are very good medicines. The symptoms have been written, but no symptom has been verified by any doctor. And the treatment that was given and the cure that was not found, the particular verification of the doctor is not present till now in the literature. See, if we go through the villages of our India, we will find homeopathic doctors giving medicine for snake bites or scorpion bites. But the snake which has bitten is really poisonous, or for that poison he identified or he antidoted, or how he cured. So far, no documentation has been named or written or found. And we will find literature about the snake bites, and in therapeutics, the literature about the snake bites, and medicines again is the snake bites only we will see. So such cases, no practical experienced person either written an article or a book. Next is, what is the cure? See, genetic disorders, again they don't have curative mechanism. The mutation can cause proteins. See, their genetic disorder will from, it is number one, chromosomal disorder, then genetic disorder, then that also the genetic disorders will to leads to endocrinal disorders, either hypothyroidism, hyperthyroidism, hypogonadism, Cushing syndrome, testosterone difficulties, bilingual sexual disorders, heterosexual disorders, plus all other disorders such as hearing aids, small pinna of the ear, physical deformities, cleft palate, they all will come for 6 fingers, they all will come hormonal, chromosomal disorders. Down syndrome, this is 21, cystic fibrosis, cause of produce thick, sticky mucus. All these are with harm due to chromosomal disorders. See, then muscular dystrophies. See, I have written these are the things: hemophilia, then thalassemia, then mild may not be treatment. See, some of them may not require treatment, but they develop with chromosomal disorders. So here, again I am coming for cure. According to Organon definition, the medicine definition is removal of all the inimic influences and causes which have produced the totality of symptom. What is cure? According to Organon, removal of all the inimical influences and causes which has produced the totality of symptom. This is cure. Then homeopathy is having 4 types of management of disorders. One is cure. Second is palliation. What is palliation according to Organon of medicine? What is the definition of palliation according to Organon of medicine? Temporary removal of the disagreeable sensation of the disease by medicine. Palliation means temporary removal of the disagreeable sensation of the disease by medicine. Then suppression. See, these things: cure, palliation, suppression, and recovery. Such type of things are not present in allopathic medicine. For them, everything is treatment. In treatment, they say it is totally, they never use word cure. They don't know what is cure. Suppression, according to homeopathy, they never entered into so much of depth into the, because they are not a holistic approach. They want to see that pathology will turn out. That's all. Again, the pathological things is cancer, terminally ill patient. Pathological disappearance of symptoms and signs will be seen. If the secondaries again come, secondaries again treatment. So such type of suppression, such type of palliation, these words are new words for them. So suppression of removal of external manifestations of the disease without removing internal effects of the vital dynamics. See, the external in homeopathy, what happens when we cure? The external manifestation of the disease, patient will gain his normal color of the skin, but internally his organs are pathologically not perfectly correct. So he will be going on getting, suppose there is fever, malarial fever. The malarial organism has caused hepatitis of the liver. So the hepatitis, jaundice may continue, or jaundice may disappear, but his fever symptoms will recur once in 3 months, and he will have malarial fever without getting jaundice. This is known as suppression. And recovery means is partial cure of the patient illness due to removal of the bad effects of certain causes. The patient feels better. Here also, recovery means he recovers from his disease condition. Partially, the symptoms will disappear. For example, knee joints, ankle joints. In rheumatoid arthritis, one joint pain will be relieved. See, patient will stress ankle joint pain. If you give medicine, the ankle joint pain may be removed, but it may come again after a month, or the joint pain ankle will disappear, the knee joint pain he will develop. So partially removal of the illness to up to certain extent, that is also recovery. So cure, suppression, palliation, and recovery. These four are used only in homeopathy, not in allopathic medicine or not in Ayurvedic medicine. So homeopathy is a spiritual approach, is a totality of symptom approach. It is a spiritual medicine. Hahnemann has considered everything, whatever that is best possible with his medicine. He started developing and writing. That's why he could find out palliation, suppression, and recovery. Even this is also enough in chronic diseases. See, despite advance, now cure is over, now curative. Despite advancement in medicine, sometimes the medical condition can't be fixed, either with homeopathy or with allopathy or with Ayurveda or with Unani or Siddha. But the homeopathy doctor and homeopathy system is so developed, the conditions which are not being fixed by allopathic doctors, the terminally ill, the rejected cases will come to homeopathic doctor. So what he will do, either he will provide palliation or suppression or recovery. He may not cure, but he will produce some type of palliation, some type of recovery, some type of suppression. So that is the speciality of homeopathic system of medicine as well as the physician. The advanced, progressive, or terminally ill. Terminally ill means usually cancer patients. Is an incurable, life-limiting condition that is likely to cause a person of any age to die within days, weeks, months, or sometimes more than a year. See, when terminally ill, cancer throat, cancer tongue, cancer throat, cancer stomach, cancer of prostate gland, cancer of urinary, both kidneys. So when the diagnosis comes, the doctor will educate the patient, he will create awareness, he will counsel the patient. From that day onwards, patient knows that he is going to die. See, natural death is accepted. Natural death at the age of 85, 90, if he dies in sleep or if he dies on the spot with accident, patient will accept the death. But in this, what happens is the patient understand that he is the only person who is going to die among his relatives and friends within this period. That is 1 year, 6 months, 3 months, 15 days, 1 week. See, this is the great concern, and this is really pathetic condition. Dying is an inevitable part of life. Death definitely comes to everybody. But for these terminally ill patients, death, he knows that the death is going to come. He will wait till the death comes. So the accepting of death is a pathetic condition. But no two end of life situations. The same death or dying are uniquely personal experience. For that patient, he has taken birth, that is also special. He is going to die, that is also specially dying. It is not because of overage or he is 92 and all his conditions, all his organs have been seized. He is going to die, where he will accept and he says, I don't need any medication, I want to die. But in terminally ill patients, in chronic cases, that is not possible. He himself will not accept, and birth and death, he will compare with other persons. So ultimately, he will surrender to the disease and he will die. This dying condition is pathetic. This was also attended in homeopathy through palliation, suppression, and recovery. If an illness that can't be cured and will lead to the end of the life, the focus of care will shift from. So for physician, what is the difficulty? Aiming to cure, to have the best possible. Suppose we are physicians, We are curing the childhood bronchial asthmas. We are curing tonsillitis. We are curing peptic ulcer, chronic otitis media, up to third grade of piles, psoriasis, and some of the skin diseases. But as a physician, when the terminally ill patient or the incurable patient comes, it is very difficult. The physician attends also shift from cure to best possible quality of life maintenance. That is, how to make him die without any suffering. See, a physician mind will change. Physician has to save the patient, but physician also will find that cure is not possible. So physician will think how to make patient to die without any pain. That is the trouble with incurable cases. So these studies, incurable cases, were not taught when in homeopathic curriculum. And any person, he will take up any glioglioma, neurological condition. Let him accept, but let us create an awareness. This awareness program is not taught so far in homeopathic medical colleges. See, no disease so far, the homeopathy curriculum contains everything, but the homeopathy curriculum never contains how many days the viral fever needs for treatment. You have to come out of the college, you have to come and learn out of our own experience, and we have to search our own medicine. But nobody so far worked standard operative procedures that are curable with homeopathy and fixed the homeopathy syllabus. This is the drawback of homeopathic literature, including the present National Commission for Homeopathy also not doing such works. See how to control hypertension, how to send a patient free from relieving the hypertension disorders and send him to cardiologist. See, they haven't, see, mother and child books they have written, and all allopathic doctors have, see, we have to try. We suppose a homeopathic doctor stays in a rural village, there will be a delivery case. We boast up about our Calophyllum, Palestilla, Colocynth and everything, but no practically SOP, standard operative procedures to conduct the delivery have not been attained. This is the drawback of homeopathic science, and this is the drawback of college education as on today. Then, what is cure? Which is curative? Cancer, malignant melanoma, glioblastoma, cervical spine cancers, cervical spine injuries, cervical paralysis, heart diseases such as chronic heart failure, kidney disorders such as chronic kidney disease, dialysis patients. See, there will be urea will increase, creatinine will increase. It is very difficult to cure creatinine and urea to become normal conditions. So a homeopathic doctor do not know. But if you add an integrated approach with dialysis, see, a patient who needs dialysis twice in a week can be terminated when we transferred, or when the time will be postponed at least 2 times in 2 weeks. The kidney disease, lung disease, advanced lung disease, fibrosis of the lungs, and lung paralysis, they all are not curable. The neurological, the total stroke, where patient is in coma, Alzheimer's disorder, motor neuron disorders, multiple sclerosis, Huntington diseases, muscular dystrophies, muscular atrophies, muscular dystrophies, pseudo-hypertrophic muscular atrophy, pseudo-hypertrophic muscular dystrophy. These are not curable. And arterial hypertension, diabetes mellitus, autoimmune disorders like that of scleroderma, chronic rheumatoid arthritis, and HIV, hepatitis B and C. See, so far, a specific homeopathic medicine which will be given and which have been found, which will make negative of hepatitis B and hepatitis C, there are only 2 articles. There are only 2 cases have been noticed at present in the internet as well as old magazines. And we never did any research also. Homeopathic doctors, experienced physician like you will get hepatitis B and hepatitis V, and you people are perfectly controlling, but you don't have documentation. This is the paucity of the homeopathic literature. Then schizophrenia, chronic depression, psychosis, dementia. See, these schizophrenia is not curable. But there is one wonderful thing recently discovered is a schizophrenia patient's cytokines, the infection, anti-inflammatory, pro-inflammatory cytokines will increase in schizophrenia. The pro-inflammatory cytokines which will increase in schizophrenia, the same type of set of cytokines also increases in tuberculosis. This is recently found in immunology. An article also has been published. Most surprisingly, this is where the homeopathy beauty is. If you read Kent Tuberculum, he will write that suppression of tuberculosis will lead to schizophrenia. It is now we have to change his materia medica. It is not suppression. The cytokines which are pro-inflammatory will be increased in tuberculosis. The same set of cytokines also will be present in schizophrenia because of tubercular miasm or tubercular bacteria. And but see how visionary, how many cases he might have observed, how he has written is a miracle of homeopathic materia medica. Then the other disease that never comes down is macular degeneration. There will be the total eye blood supply, arteries will be blocked. Then there will be swelling. The macular degeneration will come because of diabetes. That is for that they will give lesser medicine. We also have the special medicine, but usually cure never takes place. There is no cure for this disease, but there is management technique by laser and management technique. If a selected homeopathic medicine, only you physicians have to tell, because you will see more and more such cases. And other is osteoarthritis. Because of overweight, the weight bearing joints will develop osteoarthritis, and that osteoarthritis condition can't be cured. Here again I will come for what is curative. See, in homeopathy, the curative means first the totality of the medicine, selection of the remedy, then selection of the potency. Everybody, a student will be taught in homeopathic medical college that if the homeopathic medicine is given, he will be cured. The only thing is they always blame the student, a final year student or a house surgeon or a young homeopathic doctor in the society, that you don't know how to select the individual medicine. But in homeopathic case records, when we have done research, are the homeopathic patients who have been cured with homeopathic doctors, one single remedy never cures the disease until and unless it is acute, or sometimes one single remedy also cures the disease. But usually what happens, one is single remedy, second is single potency, then the change of the potency, then the higher potency, then 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 giving other medicine, and secondary to that, and a complementary medicine. See, here in homeopathic literature, there are the difficulties, the complementary. Suppose I will always tell you that Rustox is complementary to Bryonia. Bryonia is complementary to Rustox. At the same time, Bryonia is antidote to Rustox. How a medicine that follows well, that is complementary, how it becomes inimical? Then in homeopathic materia medica, there is also difficulty when a scientist asks how we cured potassium cyanide. See, cyanide is any form, 6x potency, 12x potency. We will find medicine product up to 12x potency. How the potassium cyanide has been proved on healthy human beings, why they haven't died, and what are the potassium cyanide symptoms. See, whereas in snake poisons also, some of the people, herrings, has developed snake poison side effects, but in low potency they produce the symptoms. But in high potency, the protein when we take through mouth, it will not have any harm until unless the patient is having peptic ulcer or bleeding from arteries. If the medicine or if that particular protein of the snake or the snake poison entered through the arteries or blood system, then only it produces the symptoms. But if we swallow snake poison, nothing happens. But proving of potassium cyanide, proving of Hekla lava is always doubtful, and no literature has given any satisfactory answer to all these things. These are not taught in college education. So these must be attended from National Commission. Recently, I had attended this Hanuman birthday yesterday, and I came back. But there were integrative approaches, standardization of the homeopathic equipments for potentization. Everything was discovered, but beating around the bush. No scientist want to discuss what is the material present in the homeopathic medicine and what are the pathways of action, what are the plans. See, the most prestigious institutes, National Commission of Homeopathy, Central Council of Homeopathy, Central Council for Research in Homeopathy, and National Institute of Homeopathy, all research units combined together have conducted Hanuman birthday. They spoke everything beating around the bush, but they haven't have a concurrence plan how to make these medicines. If it is not possible with us, can we give a job work to any private scientific institute to carry out what is the present in the medicine? They spent around 22 crores for Hanuman birthday celebrations. More than 5,000 people attended, but no brain was there enough to tell that we want to search what is the medicine, that is quantity of the medicine present in the homeopathic medicine and mechanism of action. They even don't want to, they are not getting any idea. We can give it to job work for scientific and industrial development. So they can do for 2-3 crores the job work, and these two problems will be addressed. They don't have any idea. This is the lacuna of homeopathy. We are also, because see, always the homeopathy is being criticized, but the efficacy of the homeopathy is always existing. When the efficacy is present, there is science. The efficacy of 30 potency, 200 potency, 1M potency, 10M potency, LM potencies was also studied. The efficacy of homeopathy in rheumatoid arthritis, in autism, in many more disorders, they have been studied. But despite encouraging results, the veterinary homeopathy also highly developed. The agro homeopathy also highly developed. And the veterinary homeopathy is showing extremely very good results in various clinical conditions. But nobody was there enough to build the chart of what is present in potencies and what are the pathways of the mechanism of action of medicines. So with this, I will end my lecture. 10 minutes are left. You can ask me some questions. Then let us think. Thank you very much. Kurup sir, namaskar.
Yes, sir.
Sir.
Hello.
Hello, sir. Kurup sir.
Kurup sir is just open the.
I see. Okay, sir.
Yes, sir. Continue, sir. Sir, shall there be 250? How many minutes more you want, sir?
Sir?
Whether we continue the session or we can go for discussion?
We can go for discussion, sir.
Okay. Okay, anyway, it's a very good session, and you really showed what to be done in these conditions where incurable cases come to a physician. How the what the patient's bystanders require, need, and just sometimes we have to palliate those conditions. And that's the reason why most people go to the other system of medicine. And we can also do such thing, but not only a palliation, but we can go ahead with the cure itself. So that's what you are telling here.
Yes, sir.
And now I invite Sridhara sir to begin the session. Yes, sir. Please unmute. Please unmute. Please unmute, sir. You can. Yes. You're, yes.
Audible?
Yes, sir. Yes, sir.
Yes. Thank you, Dr. Prakash Rao, that it is a wonderful section that you are courageously told what is happening in Delhi and our research and the commission and all these things. I experienced about it about the 2004. I got a chance to go to the ministry instead of to the Director General. One day I went there and I saw all these things and experienced. There no one is not ready to hear. All are interested to their own, that the seat and their own profession. These seats only they are interested. They are least bothered about the what we are talking really. That we know you are also worked under the CCRH. I am also worked under CCRH. So
Yes,
we
sir.
know what is going on there. So people are not interested. It is the interest that make it to. Anyway, you courageously told some of the deficiencies of the research that really we must have to do that the really how it works. That is the fundamental research. That so many money is spent for the other things. No, so not even single penny is not. They are not ready to spend for to the fundamental research. Of course, many people are trying here and there, but it is not in worthwhile. Unless and until we may not tell the answer of to the how it works, we cannot close to the mouth of our enemies. There are so many enemies we are having. If we may say that how it works, then they will keep quiet. One day will come, but when it may, how much time it may take, it is a question mark. That I don't know. Anyway, you said it is very good, excellent. Now the time is only 5 or 6 minutes. The others also like to may say. Anyway, it is a good presentation. Very good. Come again with such a solid and efficient paper. It was one of the best paper what I feel. Thank you very much. So we must have to think about it, that what it is. Of course, due to some reason, I was not able to attend to the Advanced Day, but I was hearing each and every part by sitting here itself. But nobody, what you said, nobody was not interested. Of course, everyone is interested in their post and their efficacy, showing some this thing only, but not reality. Thank you very much. Come again, such a wonderful that scientific section. Thank you, one and all. Especially you, Dr. Prakash.
Thank you. Namaskaram, sir. Namaskaram.
I am proud about you, about talking frankly about the some truths about the homeopathy.
Yeah, you are highly respected because you.
Salute for you. Thank
Yes,
you.
sir. I am very much thankful to you because you introduced me to this group. They are highly interested persons and their honesty is surprising me. So on your advice, on your instructions, I am speaking to them always, sir. Hello.
Any other people like to ask questions or anything add, they can add. I feel so. Why people are keeping quiet here, that somewhat 30 people are waiting.
Yes.
Why they can't ask, or they can.
They are writing very good lecture, but nobody is asking any questions. No questions means lecture is not up to the mark.
Sir, there are some cases what you said in the 1980. I published those days. Rastogi sir was to the that editor in charge of one journal, All India Journal. I put an article regarding to the poisons, treatment against poison through homeopathic medicines. That even Dr. R.P. Patel appreciated me. That it was published in 1982, that journal. That it was, there are very few cases there, the poisons, it is published in local, not in international way. But another thing is that even I treated so many cases of peripheral, that the the small arteries, there are that the bleeding, it is treated. Even I suffered myself up to 5 years back, but I treated myself and I treated so many cases. Some of the cases we can treat, not everything, but I like to add that also. It is not a correction, but my experience. Okay, thank you, sir.
You are right, sir. Thank you very much, sir.
Okay, that's the capillary bleeding. I was not able to read or write. Every alternative month, I was supposed to go for a eye specialist for that laser rays. That
Yes,
I
sir.
put up with that. It is a piercing. This last for 5 years, I used phosphorus 0/3 only few doses. Even some of the people who are hearing this forum also, some are homeopathy doctors, they are also experienced with that. Thank you very much for it is my experience in healing.
Ganesh sir, next lecture will be drug relationship, drug prescribing capacity. It is a survey research, sir. The truth
Okay.
of research I will keep you in front of you.
Okay, okay, sir. Now I invite Harikiran sir to say, sir, first.
Sir, sir.
Sir, Hariharan sir.
Okay, namaskaram, sir.
Namaskaram, sir. Tell me, sir.
See, wonderfully you narrated the cases and certain incurable cases. All is correct. But my comment is that, see, in certain cases are not to be cured by the homeopath as well as allopaths and Ayurveds.
Yes, sir.
Ayurvedic doctors. It's a fact. It's a fact. All the cases cannot be cured by certain by these systems
Yes, sir.
completely. But
Yeah.
see, all the systems have their own capacity according to them to palliate. Such a way, a homeopathic doctor can also do it.
You are right, sir.
So it is not a lacuna of homeopaths.
No, no, no.
Our system. It is not a lacuna, but it is the theory of nature that certain cases cannot be cured.
That what is my point is that has to be taught in colleges. See, this you have to manage. That is not possible. See, these are the things we tried. This is the research present. So that young doctor never confuses. See what happens that unnecessary he thinks that it is curable if selected on totality of symptoms and he will go for cure, there he fails. So this is the trouble, sir. And moreover, a successful doctor in homeopathy, he will think that he will be habituated to cure many diseases. So he will think, what is this? I can't cure this disorder. I have to counsel him. I have to wait for his death. And he will prepare himself to he has to make the patient to accept the death. And he has to see that patient die without any pain. So these also must be taught in hospitals so that a new homeopathic doctor will, in colleges, these must be taught. So homeopathic doctor will understand all these things. Otherwise, it is becoming very difficult. You all are senior physicians. Everybody is having their own materia medica, and you learned yourself after acquiring the degree. So our colleges do not have such medical explaining capacity, sir. That's why we are facing the trouble. Otherwise, whatever you have cured, if that is really recorded, you could have learned what is the importance of recording, and homeopathy could have been in a different state. That
Okay,
is my concern, sir.
very correct, sir. Sir, it is my opinion that most of the homeopathic institutions are not up to the standard.
You are right.
Yes.
Correct, sir.
Yes, sir.
So-
Hariharan doctor is 100% correct. We can have some more discussion in the coming presentation, sir. As the time is, as we have to close the time, close the webinar. Now I invite Dr. Ram Prakash sir to say vote of thanks to the session also.
Thank you, Ganeshji, and congratulations, Dr. Prakash Rao, sir.
Namaskar, sir.
Very nice. Namaskar, namaskar.
Namaskar,
Yeah,
sir.
very nice presentation. Excellent session, no delving session. Gyanvardhak session. What is cure and what is curative? Dynamic. Thank you, sir. Behalf of
Thank you, sir.
IFPH, very, very thanks. Again, presentation in IFPH. Thank you, sir.
Tomorrow we will have a session from Dr. Rajeshwari Rapte, and doctor will also speak about something related with the research.
Thank you. Namaskar to all.
Sir,
Namaskar to everybody.
sir, please wait, sir.
Namaskar. Namaskar, sir.
Tomorrow's subject is homeopathic research, past, present, and future. I think Prakash,
Wonderful subject, sir. I will attend, sir.
okay, that's it.
Very good.
That's why I asked sir to wait for.
I will definitely attend, sir.
Yes, sir. Okay.
Please say some thanks to the audience and the presenter also. That Ram Prakash sir is forgotten that.
Okay, sir. Okay.
Yes, yes.
Every day presentation, sir.
We are very thankful to Dr. Prakash Rao, Dr. Sridharakur sir, Dr. Hari Haren, Dr. Sir, Dr. Ram Prakash sir, and those who attend the session. And with that, we come to the end of the day, 1322.
Thank you, sir. Thank you. Namaskaram, sir.
Thank you all. Thank you all, sir.